Namaskaram Andy.
Namaste Andy.
Dr. Uday Sanakayala.
Hello Andy.
Welcome. Welcome to Texas. We are here in Fort Worth, Texas. As you can see, this is a rodeo place where you have a visibility of how back in days Texas cowboys used to live and all that stuff. You are here to visit the place, I understand. Welcome to America also. So before we get deep into understanding your, you're a doctor by profession, your profession and your personal life and all that stuff. The first question comes to my mind is, how did you end up here? You are from Guntur, right? Guntur, Andhra Pradesh. How did you end up here? Help my viewers in Prime9 understand that. And by the way, welcome to my show Point to Point with Shiv Vadlamudi.
Thank you so much Andy. Thanks for the invite to the United States. I'm honored and proud to be here representing India. I've been called by an organization called APTA, which takes care of Telugu people who are in India, and it has multiple branches. And I'm in the United States for the first time. It's a great feeling, and it's a great country. It's a wonderful country.
Okay.
There's a lot of good things here which we need to take back, and lot which we can contribute here to the society.
So what is, since you said it's a wonderful country, as soon as you landed here, and I'm sure this is not the first time you have been outside India, you've been to other places also, my assumption. What is that first one thing, as soon as you landed here, you liked it so much about America?
I was absolutely in awe with the landscaping, the lands, and the discipline. Absolutely a law-abiding country. And the second is, the people here are so friendly and they're so cooperative. Those two things really held me in place. Yes, this is the first time I'm coming to the United States. I've been to a lot of places, but this is something different.
That's wonderful to hear. So let's go a little deeper into your, personal life. Like, when did you finish your MBBS, MD? What is your specialization? Which place are you from? Give us a little bit background about your family.
Oh, that's nice. My parents are doctors, both of them are doctors. My mother is Dr. Sanakayala, who was a former health minister and had the honor of hosting Bill Clinton when she was the minister and he came to Hyderabad. My father is an anesthetist by profession. I'm married to Dr. Sanakayala, and my brothers-in-law are in the United States. I have two kids. My son has finished his MBBS Bhargav, and my daughter has just completed first year MBBS.
So that would be your third generation doctors in the house?
Kind of, yeah. Yes,
wonderful. That's
and I graduated from Davangere and then did my master's in internal medicine from Bijapur. And then I was in Cambridge for a short period where I did my MRCP in geriatrics, that is elderly care, which you call as elderly care here. And then I was in the government service 15 years, and now I'm into private care, private practice.
Wonderful. That's good. So you said you're in geriatrics. Is it called geriatrics? That's your specialization?
Yes, geriatrics or elderly care. Especially we take care of elderly people.
Okay.
And we can take care of them, yes.
Okay. So since you're talking about elderly care, I have a quick question though there. What is the lifespan of a normal Indian today, these days?
An average Indian's lifespan is 72 to 74 years today.
Oh, okay.
Well, in the United States, it's much more because you have better facilities, better access, and better care. It goes up to 79 to 80.
Okay. So before I go into your geriatrics thingy, I have a quick question here. You just mentioned about your mom, who was a health minister in TDP regime, and then she had the honor of hosting the then President of United States in Hyderabad. What were you doing back then at that time?
I was doing my post-radiation.
Okay, so you were not there with your mom or with Bill Clinton, nobody?
We did not do that.
You did not do that?
We did not do that.
Okay, okay, wonderful. So you were just doing your post-graduation
Yes,
back then.
yes.
Okay, wonderful. That was a question I caught from your information there. So when we talk about the geriatrics, now how long have you been doing this profession now? It's 15, 20 years now?
Yeah, almost 2004, I graduated, and it's 20 years, yes, last
Okay.
20 years.
So you also said you were a government service
Doctor, I'm a
provider,
government servant,
doctor,
yeah.
and then you quit that and you are now doing a private. What is the reason for doing that?
Well, a kind of personal reason, my son's education has come up and I couldn't really focus on both the jobs. Well, in government service, it's a very demanding job, and even private care is demanding, so you can't focus well. And my kid's education was there, so I kind of had to quit.
So I also did some research around your, practice, and I do hear that very good, words about you.
Thank you.
In Andhra Pradesh, at least I've heard good things about you. That your care is very optimal, um, and it does provide good results and all that stuff. Was there a case where you thought you could have done it differently and resulted in a different fashion?
I really can't tell you off the bat, but generally in geriatrics, what happens is it is a kind of a burden, kids or relatives, to take care of the patient. The simple reason being, once they get better, they again fall sick very fast. And therefore, many times they're asked to discontinue the therapy, especially critical care, because critical care is expensive. And when you want to give it for a longer time, it becomes a financial burden for them. And in India, we don't have this kind of insurance backup. So what happens is they wait for a short time, and if they don't get a result very fast, they kind of discontinue care. And that's one area which we're trying to improve by getting people to get insurance and other means of support. So the many times which we feel bad when they say we want to go back, and that's the amount of time we could invest on this therapies. Then what I find it much simpler is that if the parents are convinced by the children or their relatives to go for a regular checkup, let it be a physical checkup or an online checkup, which we do these days, it will be much easier to pick up a problem. Like recently, we had a patient whose blood pressures were 180 or 120 when she had come to the hospital, and the last previous visit was 1 year before. And if she had come anywhere between, probably we could have had a better outcome. So this is where we're trying to focus by regular calls and being in touch with the patients.
So you're saying the education, there needs to be a awareness or an education to the patients and to their kids, you're saying, or it's just to the patients you're referring
It
here?
it's not more of an education. I would rather say to kind of prompt them. They know that they have a problem. That would save a lot of problems. Regular checkups and minimal screening programs.
So what you're saying is, I have to come to another important aspect where nowadays, if you see back in India, lot of kids are here,
Yeah.
right? And their parents are there, right? And so there is a gap now. Now, from our culture where, kids take care of their parents and all that stuff, that is changing a little bit, but also being such a far distance, they cannot take care of them on a day-to-day basis, right? So I will come to that aspect. But what you're saying is every elderly patient or a person, whether it is every person,
rather not a patient.
yeah, man or woman, if they have a problem or don't have a problem, you're suggesting they should come and visit the doctor to do a regular general checkup and make sure that, hey, everything looks okay. The basic vitals look okay. Is that what you're suggesting to avoid long-term problems?
Yes. What I would say is, in case if they have been diagnosed with some problem, most commonly they have either hypertension, diabetes, or osteoarthritis. These are the major issues. And once they cross 60, they have sometimes a cerebrovascular accident or stroke or heart failure. These are the 5 main complications we have. If they come if the patient is taking any medications, if they come on a regular basis, at least once in 3 months, that's a quarterly visit, yes, you can prevent a lot of complications. And if they have no problems at all, an yearly screening will definitely help, because once a person crosses 60, you really don't know. Because when I was a postgraduate, in my 3 years, probably we had seen 6 or 7 malignancies, that is cancers. In the last 15 years, probably I have seen around 60 to 70 cases. But in the last 2 years or 1 year, I have already seen 15 to 20 undiagnosed de novo cases. So screening doesn't hurt, and it's just going to take probably 2 hours or 3 hours a day, a single day, and that's not going to hurt. And the most important thing is we have a protocol now in my clinic where we check blood sugar of every patient who comes in when they come for the consultation, and 50% of them above 60 years who have not diagnosed with diabetes earlier have been diagnosed with diabetes next. So screening helps a lot, yes. Treatment definitely improves. Screening helps to prevent a lot of complications.
So in general, we have this taboo, right? I mean, people would not visit doctor unless they really see something wrong going on with them, right? And that's a big issue for various reasons. One, because you are scared of doctor, because you don't trust the doctors, because you think that they will do all kinds of testing and whatnot, and then take lots of money from the individual, right? That's the biggest concern. That's the biggest scare point, where people don't turn up to doctors if they really don't see any issues with them. Especially, I mean, even the younger generation or the elderly people, right? Elderly people, normal, our own thought process is, I'm getting old, what is there to go and check it out and all that stuff, right? But they don't realize that what you just said is a screening will help them and their kids,
Yes.
who are far off, right? So how do you eliminate, what do you suggest to them through our Prime9 TV channel on taking that fear out and encourage them to do quarterly or half-yearly visit with doctors like you?
Well, the answer for this is quite elaborate. Let's cut it short. Now, earlier, probably in the 70s and 80s, we used to have a family physician kind of a model. Well, you have a doctor whom you have been seeing since you're a child. You have a problem or you have some issues, you go to him and he says, go to this gentleman. Today, with the help of Google and the internet, you choose your doctor. So, partly they don't know about you. They have to evaluate you from the beginning from the bottom. And unlike in America or the West, we don't have records that well maintained in India, which is a fact. So I don't know who's walking in and what is walking in. So I need to do some fundamental tests. But I do agree, sometimes it becomes more of a uncomfortable situation when a battery of tests are written. What I felt is, if a patient comes to a doctor with an open mind and says that he wants some help, 99% of the times the patient is benefited. It all depends on the doctor-patient relationship, and we've been in this field of service for the past 40 years. I'm the second generation and my third generation is coming up. We have had no problems. It all depends on how the patient approaches and what the doctor can deliver. So it's all a relationship.
You're talking about trust.
Trust, yeah.
So how do you build that trust without even a patient, if a patient is coming to you for the first time, how do you build it? How do you make him feel comfortable that, hey, I'm not going to rip you off. I am here to do my job, which may or may not require a battery of tests. How do you convince them? How do you
Talk
do
to
that?
them. Talk to them, explain to them. What happens most of the times is, today what we are saying is, patients come with a list of tests which are not required, and the doctor may find something which is required. One. On the contrary, the patient says, I have 1, 2, and 3 problems, and we tell them, you need these tests, explain to them. I don't find any problems in that. Generally, even if it's an expensive screening test, if you're able to communicate to the patient properly, that's it.
That solves the
As simple
problem.
as that.
I think.
Yeah.
So,
I don't see a problem at all,
how,
because,
okay. So, what do
yeah.
you expect from the patient also for you guys to build the trust or to do a start? Like, what do you expect from a patient? What
Uh,
is your general expectation? What actually triggers you off when from a patient, or what do you expect? Let's ask that.
I have no expectations from the patient except to help them and treat them. That's a fundamental thing. The problem comes in when they ask something from the internet. Now, most of the information in the internet is contextual. For example, if you have a pneumonia, let's say a patient has pneumonia, in the internet it says a patient having pneumonia with these parameters needs to be hospitalized, need not be hospitalized, can go home on daycare, and things of that stuff. But let us take my branch. In the elderly, a patient with the normal parameters in the morning can become very sick by night, and he may even need assisted support by the next day morning. On the contrary, a young patient who looks very sick and with bad parameters can just improve with oral medications. But that is not given in the net, because the net does not have experience. It has data. And this is not trying to build a bridge or a table with nuts and bones. It is a human being. It has got life in it. And that can be only addressed with experience. So if if you have a certain problem and you're not comfortable with what the doctor has asked you to do, take a second opinion. The internet is not a doctor. It is not a doctor. Go to another doctor and he might get you a better answer, not the net. And this is an area of concern for us, yes.
Okay. So what you're saying essentially is the data present on the internet might be right, but it may not be relevant to your situation. So do not make any interpretation out of the data you have on internet by yourself and then go to doctor. Let the doctor do the job is what you're suggesting.
Yes, you can cross refer or you can take help from the internet, but don't rely on the internet, which is happening these days. In part, it could be because the son is in the United States, is way across, and the parents are there. And so they have no way of communication, and they generally can't communicate with the doctor's side. So they would like to take some help. But what's happening is they are completely relying on the net and not on the doctor.
Welcome back, Dr. Garu.
Hello, Andy.
I see that we had a brief discussion today, this afternoon, when
Yes,
we
exactly.
were at
Yeah.
the Texas rodeo. How was your trip there?
It was excellent. There was a wonderful preservation of American culture and the cowboy culture. I had a wonderful time.
Wonderful, very good. That's good to know. So we left at talking about the trust between the patient and the doctor,
Exactly.
right?
Yeah.
And we also were talking about how the patients look at the Google and take that as a conclusive without taking the entire context into place or relevance to their situation.
Something what suits them mostly.
Right. So let's get a little more deeper into that. Most of the cases, I mean, now that you are in America and then you practice in India in Guntur, lot of kids who are here have parents who are aging. And the question I'm referring to is because you are a geriatrics specialist.
Yes.
I hope I said it right this time.
Yeah.
So, what is your suggestion for one, the kids here, two, the parents there, or to both, to make sure that they are taken care well, they are well taken care, and they are not going through a medical crisis?
Yeah. Now, what happens is most of the times, whenever someone's father or mother is sick, the children rush to India and then they seek medical care. Now, in the elderly care, the most important point is prevention, and that can be done only through periodical checkups. Now, what happens is it is not necessary for the children to be on site. They can do it remotely even from here. For example, if you have a doctor whom you know, or if you have a doctor who is close to you, you can always get the labs done remotely and get the results validated. What happens, most of the times in India is, for the convenience sake or whatever reasons, the parents themselves take the help of a local doctor, usually an unqualified person or a pharmacist, and try to tide over the temporary crisis. Now, that does not solve the root problem and it creates more problems. For example, for a fever, they just keep taking paracetamol without knowing what kind of a fever it is, and then it worsens. Periodic checkups with a doctor whom you know or someone whom you can reach out and talk to with reasonably qualified lab results will help in kind of preventing most of the complications. And sometimes, whenever we see something wrong, or we see a red mark somewhere, or we find a potential problem, we try to inform them and try to encourage them to get further evaluation. And what I have seen is prevention is always better than cure.
That's a old saying.
Yep, all's good, even today.
Oh, good, good. So to summarize, you're saying one, you have to have a periodic checkup, as in
Yes.
like 3 months or 6 months, whatever.
Yeah.
Minimum of 6 months.
Once in 6 months, at
Once in
least.
6 months,
At least,
Okay.
yes.
So once in 6 months periodic checkup, that should include the blood test
The
and whatever.
simple blood
basic-
tests,
basic blood
like the hemoglobin level,
Mhm,
and generally they have problems with the kidneys, so a serum creatinine,
mhm.
and a simple blood sugar. And if they're either hypertensive or diabetics, 3 months sugar level, which is the HbA1c, which most of you are.
If they know
Yes.
that they are
If they
hypertensive
know,
and
yes.
and
Diabetics,
diabetics.
yeah.
If they don't know, your suggestion is
Oh,
to
fasting blood
is-
glucose. Oh,
Okay.
yes. Probably this would cost not more than $500 to $600.
Oh, okay.
Indian rupees, 500 to 600 rupees. American dollars, $10.
Yeah, not even $10.
Not even $10.
Yeah,
So that
nowadays,
includes consultation. So
Okay.
if you're willing to spend $10 in half an hour
Mhm.
and probably call the lab guy to your house and get your test done, yes, you can prevent a lot of complications. I mean, to put it across in a personal way, because of course, though the circumstances were different because of COVID then, because we could not really reach out on time, I even had issues with my own father-in-law, and ultimately we lost him. So probably a simple checkup could have prevented a lot of things. Yes.
Okay. So you're saying you lost your father-in-law because you could not do the periodic checkup on him. Is that why you lost him? That's what you're suggesting.
Yes. It was COVID then,
okay.
but that's unfortunate.
Oh, okay.
Yeah.
So yeah, COVID had different.
It was a different ball game completely.
It was a totally different ball game. Yet today, still people are still facing COVID
Yes,
scenarios, but it's not as bad as earlier. Now, to summarize that, it will only cost 500 to 600 rupees
at the most.
at the most. 6 months periodic checkup.
Yes.
Then you said serum
Creatinine. Yes.
yeah, and then diabetes, and then hypertension,
Yes.
and what was the other test you said?
Hemoglobin.
Hemoglobin test. So these 4 tests are basic tests. Anybody of what age should get done?
Anything above 60? and above.
Okay, so what about 50 to 60?
Yes, there is no exclusion as such.
Okay.
Everyone is included.
So if somebody's parent is like 50 years old and
Yes.
they're here, you are still suggesting even from 50 they should have a 6-month checkup.
Yes,
And
it
that
would
is-
be very, very safe. And unless and until we evaluate them prior, we have to treat a big disease, which is difficult and probably it could have disastrous effects.
So earlier in your conversation, you were also saying qualified doctor. And as we know today, there are so many kids, even from rural places, coming into America.
Mhm.
So were you suggesting that they should not go to a unqualified doctor, like a registered doctor? Is that what you were suggesting?
To put it across in a different way, for example, if it is some rural village in India, and in the middle of the night, if there is no medical facility, there is some person who takes care, like there is, there are some people who are trained, either self-trained or trained in some hospitals.
So RMP, can I
Kind
call
of,
RMP?
yeah,
Okay.
yeah.
Mhm.
And they take their help. Well, in an emergency like that, yes, probably just to pass the night, to tide over that 1 or 2 hours.
Mhm.
And I request all children, probably who are in the United States, the next day, please seek out qualified help, either an MBBS practitioner or a family physician or an MD or an internist. Probably they can throw better light on what the actual problem is. Most of the times they treat symptoms, not the cause. You have to treat the disease to come out of it. Recently, probably 15, 20 days before I came to the United States, we had a patient who came with the fever, a simple fever. And she was taking paracetamol for a long time. And when we evaluated her, we found her to have a bad pneumonia, and we had to go through a lot of trouble to even save her. Luckily, she was saved. And actually, while I was coming on the flight, I met a family who were rushing back because they lost their father
Oh,
to simple
sad.
hypertension.
Wow,
That was very sad, very, very sad. And when I asked him, why have you not taken precautions? He said, my father would not go. So you have to put in a mechanism where you connect to your parents on one side and probably a doctor whom you know, get some labs done and talk to the doctor. Today it's digital age. Everything is available on phone, everything is available through the net, so you can connect.
Sir, one quick question,
Yep.
doctor. So I picked it up from the conversation you had. You just said, right, that his parent would not go to the doctor.
Yes.
Do you think there is a possibility these days that a doctor goes to the patient?
That's a difficult question, but you can always have a video conferencing.
Okay.
For example, I do cross consults on video.
Oh, okay.
But if I find something problematic,
Uh-huh.
I make sure that I inform them that there is a problem they're about to face. And I also inform the same to the kids of the parents who are here.
Mhm.
Now, remember, that is not an excuse for not seeing a doctor.
Mhm.
It will only help you and probably the doctor to tell that, yes, he is okay. But if the doctor feels that they should come, they should see the doctor. There are so many numerous instances of people whom I know very well, just because the parents were reluctant to come, they would not come to the hospital, get checked up, and then things turn out bad. So from then we started this new method where we make a call on a video call to the parents, and then we make sure that they're okay. And on the call, if you find something wrong or if you find red mark, we say, please come to the hospital. You need to be checked in the hospital. And that's working really well these days.
Okay.
Yeah.
So fundamentals can be checked on a video, is what you're saying.
By and large, yes.
Okay. But your preference is always that a patient should come to the doctor, to the physician first, and then get it checked. The basic
Any
checks,
given
right?
day, there is nothing like seeing a patient in person. When that is not possible, probably we can make a video call and then with the child or with the children also in the call, we try to make sure that we explain to them that there is either no problem or there might be these problems, they need to come to the hospital.
Okay.
This is more of like a screening rather.
Okay. So before I go to the next question, sir, you were earlier talking about your brother, and I'm not sure if I remember asking about him. Do you mind telling about your brother also on the camera?
Yeah, my brother is an obstetrician. He's a gynecologist and he's into infertility. He's made a good name in infertility. He's Dr. Sanakayala.
Okay. What about his wife?
She is Dr. Rajkumari. She's
Okay.
also an obstetrician. She's more of a laparoscopic surgeon.
Okay.
And we all practice together.
Okay.
And he has two kids, Dr. Karthik and Dr. Chandana.
Oh, okay. So he also has kids with.
All of us into the same business.
Oh
Yeah.
my God. Okay.
That's a family business.
That's a family business.
Yeah,
That's
kind of.
Good. Yeah, going back to the suggestions from you for the parents and or the kids. So ultimately, no matter what, the individual should be seeing you, and more often also what I see is patients directly going to the specialists. What is your comment on that?
To put it another way, in Germany, there's a saying, a gastroenterologist diagnoses an MI through an endoscope. In the sense, for example, if a specialist is consulted, rather, he would think of his specialty ruling out all the causes for a certain problem, whereas the actual problem might be a very simple one. Second, the specialist has a telescopic view of the problem. He thinks about more of his specialization, areas of interest, and he tries to rule out everything from the most minor ones to the most serious ones, which will be a burden on the patient. On the contrary, a physician or an internist, as you call here, looks as a whole. In the sense, he has a holistic view of the patient. Many times we see patients going to multiple specialists, getting multiple prescriptions, which we call the polypill, and when we put them on a table, all of them are the same. So he's taking a B complex from a neurologist, an antioxidant from the cardiologist, and another B complex from the nephrologist, whereas a physician would do with a single medication. So a holistic approach is needed, and that is what only a physician can do. And if he feels it is essential, we would refer them to a specialist. Actually, in the United States, they're not called specialists, they're called subspecialists. A physician is a specialist. A neurologist is a subspecialist.
Oh, okay. I didn't realize that.
Yes, it is.
That's good to know. Okay, so thank you for all those guidance. In a layman terms, doctor, so I do understand that kids here do call their parents once a day, twice a day. That conversation keeps happening, right? So how do the kids, besides asking them, requesting them, forcing them to go to doctor for a regular checkup on a, once in a, twice in a year, like once in 6 months, periodically, right? How would, while they are talking, what is that you would suggest them to ask of their parents? When they say, hey, hello, dad or mom, what is that you want them to ask and sense if there is really a problem or not? What would that be like?
In other sense, what you meant was, what are the problems elderly people have? Kind of.
Yeah. But a lot of times parents may not be able to express them.
Yeah.
But as a kid, because he's far off, as a kid, what is that he should be asking a question? Like, hey, dad, how are you doing? Are you able to sit properly? Are you able to walk properly? Things like that.
Yeah. Let's go step by step. Now, one of the most important things which happens in the elderly is dementia. They forget things. So they keep forgetting things, and that's one thing which you can pick up in a conversation. For example, they would not be able to remember what they've had for breakfast today.
Okay.
So that is a big area, which is dementia and Alzheimer's, which all of us know in the United States, which is a significant problem. The second thing, which will not be seen over a very short period, but they say, your father is not able to drink coffee or tea and he's spilling a lot. That is because of Parkinson's.
Okay.
Also, the partners or the mother or the sister will be able to tell you that your father is not walking straight. He's either dragging or limping. That could be because of a partial stroke or a stroke in evolution or things of that sort. Now, these are the major neurological issues generally elderly people have. One is either Parkinson's or Alzheimer's or stroke. When it comes to the cardiac problems, usually at that age, if they have a stroke, it is associated with chest pain. But in diabetics, it is a silent chest pain, the silent MI, what we call as. They would not have pain. On the contrary, they'll have severe sweating. Or if it has been a minor stroke, they would not be able to perform the normal duties. Like if he walks a few feet, the mother would say, Dad is getting exhausted very fast,
Oh,
or he's sweating too much.
okay.
He's not able to walk a few feet. He's not able to lift a bucket of water and things like that. These are the things which you can watch for and keep a watch out for. Now, another thing is usually it is not what the patient says, but it's what the other person, the companion says. He's losing weight.
Okay.
He's losing weight a lot. He's eating well, but losing weight. And that could be a potential sign for a cancer or a malignancy, which we call loss of weight. And they don't feel hungry, they lose their appetite, and they start losing weight drastically. That's what we see. So that is one thing which you have to watch for. Now, things which you can prevent. For example, most of you in the United States have a Western toilet or the commode, whereas in India, we still have the Indian toilets.
Oh, do they still have Indian toilets?
They do have Indian toilets,
No,
yes.
I thought everybody pretty much have Western toilets.
We still do have in the rural areas.
Oh, okay. Rural areas.
The problem is not with the toilet, but when they get up or they sit, they fall. And once you have a hip fracture, that's the end of the story. You're done. You've had it. So falls, preventing falls. Now, one more thing which the Indian parents would be very insistent is not to hold a hand stick. They would feel a lot of pride to hold a hand stick. They say, do you think I'm old? And they are 75. They don't accept that. I'm sorry. So it is always better to give them a hand stick, which is a beautiful one, and present,
it's okay.
And it's okay. Tell them it's okay. One more common area where they have issues is eyesight. They keep bumping into walls, and the mother says, "Why is your father bumping into walls? Why you see no injuries on the face in the phone call? You see no injuries on the shoulder." The reason is they have cataracts, so they keep bumping into walls, and these are all the preventive things. And if you can install a handle in the toilet to either sit or stand, that makes a lot of difference.
Wonderful.
And another common area is when they get up from the bed, if they have a high placed bed, they fall. So a low placed bed where they can comfortably get up and stand comfortably.
Okay.
So these are the smaller things, the finer things which are not difficult to implement, but probably quite easy to implement, but brings a lot of change in the lives of patients.
That's a wonderful information, Doctor.
One more thing. I'm sorry to cut you. And this is a bit delicate one. A patient who has a bowel or a bladder incontinence would never agree to that. In India, they would die, but say rather accept that they have bowel incontinence or bladder incontinence. The only way you can tell is the partner telling that the patient is smelling a bit. So you have to ask the mother. Once they cross 70, if the gentleman is passing urine more at night, it could be diabetes or a prostate. So these are the things which subtly tell that there is something wrong going on, and you kind of better to get checked up.
Well, these are definitely extremely important points you have mentioned, Doctor. We really appreciate for our viewers. What do you suggest on if a patient walks on a daily basis? Do you think any of these things can be delayed or prevented?
You mean
walking? Yeah.
Well,
If walk is a part of their life. Yes.
I would insist that every person walk till the last day of their lives.
Wonderful.
The most important thing in the elderly is muscle loss, and it's called sarcopenia. And the only way to prevent it is walking, walking, and walking.
Oh.
It doesn't matter how fast you walk, it
Mhm.
doesn't matter how long you walk and how much time you walk,
Mhm.
but walk.
Okay.
A simple walk prevents many things.
Okay.
And that has been proven in many studies, especially in China, because
Mhm. Mhm.
whatever distance it is, they walk. And we find that in China and Japan, the longevity of the people is much, much, much more than many other countries.
Very good. That's good to know, Doctor. Well, thank you for all that. The prevention ways, prevention
Preventive
methods,
ways, rather.
preventive ways for our viewers, so that they can take a better care of their parents and also give them a better life and see them live happily for a long time. All
Yeah.
right. Thanks a lot for all that information. I would want to go slightly deviate from your profession,
Hmm.
considering what is the background you and your family has of politics. That your mom was a health minister. So, well, one, I would want to understand your view on the current politics in Andhra Pradesh. I'm not talking about anywhere else. What is your current perception of politics? By you have seen, we all have seen, Chandrababu Naidu Garu has become the chief minister, and Pawan Kalyan Garu has become the deputy CM.
Yes.
Right. So, and the way they won was the landslide majority and all. What is your opinion? Do you think the reason why they will be able to withstand that for the entire 5 years, and will they be able to come into the power the following term also?
Well, it's a very difficult question to answer, but I'll do what best I can. The people's mandate was a landslide victory. That's something no one can deny. And to add, there is no doubt in Pawan Kalyan's role in this mandate. Not only has he set a direction for the state, but also for the country. And probably because of the Telugu Desam and Pawan Kalyan's and BJP's alliance, we were able to give security to the entire country, where the center was stabilized and Modi has again become the prime minister, which is probably very good for the country. From at least that's my take. One. Two, they came to power with a lot of good faith and good hope. And we have seen Pawan Kalyan Garu and Chandrababu Naidu Garu in the last 10 years and 20 to 25 years. Beyond questionable doubt or reasonable doubt, Chandrababu Naidu Garu is a visionary. I still remember that when in 2000, if I'm correct, we were given a book called Vision 2020. And today, you are seeing that vision in the form of Hyderabad. His vision is unmatched. At the same time, he has a wonderful form of Pawan Kalyan who will set the right path. Pawan Kalyan Garu has stood in the past 10 years. He withstood personal degradation.
Yeah, of course.
A
Yeah,
lot of
because
personal,
everybody heard that. Yeah,
yes,
on the
he
TVs, on the
was
social
so
media,
much,
everywhere. Yeah.
he bore the brunt so majestically and so honorably, and he never retaliated. And I think he will deliver, and that is beyond doubt. We are looking at a golden period for Andhra in the 5 years, next 5 years, and if that happens, there should be no doubt in them coming back to power.
Okay, so you're confident that they will. So another thing, doctor, them doing the progress or the development, whatever they have to do in their own pace, versus if they don't do enough for this public, like you saw the last time where they kicked out the YSRCP party, and that may happen to your TDP and Janasena party alliance with BJP also. So, do you think they are going to accelerate the development or the progress, whatever they have to do in these 5 years?
If I have to put it in another way, in the past 5 years, we have been set back by whatever reasons and policies are by another 20 years. So, in this 5 years, they have to take the state 25 years ahead.
Right. Right. So that also means that they have to accelerate it.
They have to work 48 hours a day.
Right.
And unless and until they deliver, the people will give a mandate.
So that's my question. Do you think they will be able to deliver? Was my question.
They have to deliver.
That there is a difference. Do you think they will be able to deliver? Is the question.
Looking at their commitment, they will deliver.
So you're confident that they will deliver?
Yes.
Very good. Now, so another question for you, Doctor. A straight question for you. Are you a pro TDP or a pro Janasena party or a pro BJP?
That's a tricky question. If you ask me to take sides, I would take Janasena.
Well, your mom was a TDP supporter, right?
And she is still a TDP supporter.
Oh, okay.
But
so mom
yes.
is from one party and son will be from another party.
But I personally have, let us say, an admiration for Pawan Kalyan, extreme respect towards Chandrababu Naidu garu.
Okay.
I have no questions about it.
Okay.
The way he took the state forward earlier, Chandrababu Naidu garu has no match. And we are all looking towards Pawan Kalyan garu because we want to see how he delivers. And I have a very personal admiration, right? Let it be from his movie background or whatever, towards Pawan Kalyan garu, because he brought the state out of misery. In a single word, he brought the state out of misery. And unless and until you experience that, you can't tell that.
Okay.
It's difficult to explain in words the troubles a few people have caused and the troubles few people have gone through. And today people are really breathing air. I would not blame the previous government, but their policies were such that development took a beating.
Oh, yeah.
And
no, I clearly agree on that. I have my own reservations on previous government. So
let us not make it that way. Yeah,
I don't want to.
We should build rather than criticize.
Correct. No, I agree.
I would strongly adhere to that.
I agree with you on Doctor, and then also looks like the way you had just answered about the previous government also tells me that are you getting into politics, or do you have plans to get into politics now that because current government also has a lot of doctors in them, business people, if you know, like Pemsani Chandrasekhar Garu, he's a doctor from Dallas. So a lot of people are.
Is he from Dallas?
Yeah, he is from Dallas. Yeah, he is from Dallas.
I didn't know that.
Yeah, he's from Dallas.
That's nice.
Are you indicating that you are going to get into politics too?
I would not say politics straight, but I would say public service, yes.
Oh, okay.
Yep.
Oh, wonderful. So you have a path forward.
Yes, I have a path line, and if it leads to being in politics, I have to take the route. I will do it.
You will do it. Oh, wonderful. Thank you. Thanks for revealing that on our channel. We are very honored to have you and then hear that news also. Likewise, it's a pleasure. Wonderful. Thank you very much, Doctor. I think that was my political question. One last question in politics. What is your take on Prime Minister Modi ji? Do you think he will be the next Prime Minister also? Coming elections? If he becomes, it would set a record in India. No one has become the Prime Minister for the 4th time. Oh, okay. If you ask me personally, yes, I would love Modi ji to become the Prime Minister again. But will he? That's the question. There might be a lot of factors against him, but we have to see how he governs the country. And I wish he becomes the Prime Minister the next time. Personally, yes, from my side, but he should become the Prime Minister. Very good. Well, Thank you very much, Doctor. That's all the questions I had for now. Thanks for coming into my show, Point to Point with Shiv Vadlamudi. And I hope you will have a safe trip back home.
Thank you so much. It's been a pleasure and both a surprise to be on the show. And it's an honor to be on your show, Mr. Shiv. We are looking forward for you to come back to India and interview a few people there.
Thank you. We
Thank
will
you.
certainly do it, sir.
Welcome.